Welcome back to the final video on the lipoma series, where I will be talking about risks and complications of lipoma surgery and what is this crossing the road risk and how you can avoid risks and complications after lipoma removal. So let's dive into it. I actually searched for videos on complications of a lipoma and I didn't find any on YouTube. That's probably because there aren't a lot of complications in lipoma surgery. It's one of the safer ones. But I always ask myself, what is the worst thing that can happen when you have a lipoma removed? I've spoken in my previous videos about what can happen when you don't get it removed. I reiterate, lipoma surgery is very safe. These are crossing the road risks. Before we move on, every week I try to upload quality content on plastic surgery and aesthetics, so please share, like and subscribe. There are two main types of risks and complications when it comes to lipoma surgery. Number one is related to the nature of the lipoma itself, and number two is related to cosmesis after surgery. Okay, things like minor pain, some bruising, some amount of swelling is absolutely expected because at the end of the day, this is surgery. So those are not those we do not term as complications. So what are the crossing the road risks? Crossing the road risk refers to this phenomenon which, like, let's say you're crossing a road and then there's always a possibility that you could get hurt while crossing that road, but that doesn't stop you from going out onto the road or trying to cross the road in any case. So things like infection and blood clots, also called hematoma, these can occur. These are a possibility, but they are not probable. And therefore, patients should not worry about these risks while getting the surgery. The risks I'm talking about are entirely different. So in the first category, which is related to the lipoma itself, wrong diagnosis of a lump can lead to this. In my previous video, I talk about how some conditions, the just right list, can mimic the appearance of a lipoma, and if you go in to get these removed, one of two things can happen. One, your incision site will be very big. As a very average figure, 6 mm is if you cover half your thumbnail. Yeah, if you do that, that's about 6 mm. So that's the size of the cut. Even a 4 centimeter lipoma or a 10 centimeter lipoma, it doesn't really matter. But if your diagnosis is wrong and it's not really a lipoma, then it's not possible to remove through such a small incision, especially if it's a ganglion cyst. And then let's say you do actually have a lipoma itself, but if it is calcified or saponified, so I again talk about this in my previous video where I talk about secondary changes that can happen to your lipoma, especially if it's been neglected or traumatized over the years. Trauma as in physical trauma. I don't think lipomas are feelings. Do they? Okay, moving on to category 2, where we talk about the complications and risks after surgery. This is a tricky one because it's not seen in everybody. After the 12th day of surgery, if you do not start scar massage for lipomata, despite whatever good results you get immediately after surgery, if you do not massage that scar, you're not going to end up with a very pliable scar. So scar massage, number one important thing after surgery. After pretty much any surgery, you should talk to your surgeon before you go ahead with scar massage. But I tell all my patients to start on day 14 after surgery and then continue this for 6 months at least. And what's a retained stitch? A retained stitch is, I do not face this because I use absorbable and dissolvable stitches. There are two types of stitches that are used in surgery, the kind which get absorbed by the body, there's the other kind which have to be mechanically removed. So I use absorbable stitches because I do not believe in patients coming back repeatedly for things like, stitch removal, etc. I'd rather they take care of themselves at home. But this is one of those things that can occur with removable stitches. Another thing is scar hyperpigmentation, and this is one of those crossing the road risks that makes the surgeon and the patient want to sit down and cry. Okay, I'm exaggerating. What happens is with Indian skin tones, we are warm tones, we have brown and darker skin, and when we even place a small stab incision, like a 6 mm incision, the pliability of the scar goes really well with massage, and mostly the pigment color also fades. but sometimes it just leaves these very dark scars. They're not very prominent, but the very fact that they're pigmented makes them look very unaesthetic, and these are a little hard to get rid of. I've had patients who, with just bleaching creams, topical therapies, they're okay in like 2 months, and I've had patients who've had this for more than 6 months and nothing really seems to budge. So this is the end of the lipoma series. I hope you enjoyed it. I enjoyed making the videos, and if you have queries, please drop a message on the WhatsApp number. There are also links to Skull Massage as well as to my previous videos in the description. Thank you.